So what is CCI and how does it affect people? And then I'm going to talk a bit about my own situation and show my results on my own stuff. So CCI, this is a really good article. This is what is craniocervical instability. And then it says, what is Ehlers-Danlos syndrome right here. I literally need to read off this article. I know that sounds like a cop-out, but it's such a good article. See, it's a real article. There's pictures and everything. What is craniocervical instability? So this is important because people that even know of EDS and its complications think that Chiari is the only complication you can have with the head and neck. Chiari is only a severe manifestation of CCI. CCI is a broader spectrum problem, and it means craniocervical instability. It's when this is unstable, and that can become a Chiari, and I'll read about that. But CCI itself can cause a lot of problems for people, can screw up the autonomic nervous system and everything. It's just, so here it is. CCI, also known as the syndrome of occipito-atlantoaxial hypermobility. Ooh, that's a long word. You got to see that word there. Goodness me. That's crazy. Is a structural instability of the craniocervical junction, which may lead to a pathological deformation of the brainstem, upper spinal cord, and cerebellum. It primarily affects people with Ehlers-Danlos syndrome and other hereditary disorders of connective tissue. Ehlers-Danlos syndrome, EDS, is a connective tissue disorder, genetic, that is caused by a defect in the structure, production, and processing of collagen proteins, or proteins that interact with the collagen. Collagen is kind of like your body's glue. It's what holds your skin, joints, blood vessels, and other major organs in place. It typically presents itself in childhood or young adulthood with hypermobile joints, prone to misalignment, stretchy skin that tears easily, and fragile blood vessels, prone to cardiovascular complications such as aneurysms. EDS is currently considered to be a rare disease as it affects approximately 1 in 5,000 people. However, due to its vast underdiagnosis, yes, this is true. It's really, really bad. There's a presumed frequency of 1 in 200. Wow, that's a huge difference from what 1 in 5,000 diagnosed people. Pretty bad. We know that EDS is grossly underdiagnosed, and many people out there that are very, very sick and basically rotting. Anyway. EDS can be diagnosed by skin biopsy, DNA blood testing, or clinically by a geneticist. For more, or clinically by a geneticist. Click here, and then there's a link. How does CCI occur? 1 in 15 people with EDS will go on to develop CCI. Oh, yay. I'm so happy I get to be the 1 in 15 person. Wonderful. Due to a lack of connective tissue support at the craniocervical junction. While some EDS patients present with this condition after head and neck injuries like whiplash, for the most part, this condition tends to manifest gradually through repetitive stretch injuries from actions as simple as turning one's head. So, after years of me just like turning my head everywhere, that's loosened it. These stretch injuries can result in one or more and in many times all of the following. Number 1, nerve dysfunction. Deformative stress of repetitive stretching of the craniocervical nerves can lead to cell dysfunction and nerve death in this area. Ugh, that doesn't sound good. 2, thickened odontoid capsule, so pannus formation. When joints are hypermobile, pannus may grow in a tumor-like fashion where it may erode articular cartilage and bone. When this occurs, the odontoid bone, a bone in our upper neck that acts as our head's axis, it can compress the brainstem. So there's one. Number 3, this is the one that we think I have. And that will make sense in a minute. retroflexed odontoid. Loose ligaments can misalign the proper angle of the odontoid bone, causing it to push backwards, compressing the brainstem. Mine is going to the right, so. And it's interesting because in my pictures, like I've mentioned, I am, like, if I'm smiling or laughing, one side of my face, my right side, is more, like compressed, and it almost looks a little bit like Bell's palsy, which is when there's the one side of your face that's kind of droopy, except it's more like wincy. And that's the stupid compression. It's very obvious. My friends have actually pointed it out. Right now in my profile picture on Facebook, you can see it. It's not like horrible. It's not like I'm like, but it's obvious. Yeah. So number 4, excuse me, Chiari malformation, a downward displacement of the cerebral tonsils, part of the brain that puts pressure on the cerebellum and brainstem, progressively damaging them over time and blocking the flow of cerebral spinal fluid. That's a very serious type of CCI. Number 5, cranial settling, the skull sinking downward onto the spine. In severe cases, basilar invagination, don't know how to pronounce that, occurs, where the tip of the odontoid process projects above the foramen magnum, the opening of the bottom of the skull. Now, that doesn't sound good at all. I have crowding in the foramen magnum. That's what Dr. Rossner said, the neurosurgeon. So, unsurprisingly, the histopathological changes in neurons that are undergone in these situations would not show up in a routine diagnostic test, like a typical MRI. In many cases, however, Chiari, cranial settling, and a retroflexed odontoid may be demonstrable on MRIs, but typically only when imaged in the upright position. This is why I crowdfunded for an upright MRI. This would explain why many of these patients' diagnostic imaging reports state negative results. And that's brutal because, doctors just think we're crazy and we're dealing with this horrible problem here. The following image shows a healthy-looking MRI of an individual with EDS and CCI lying supine on the left compared with an MRI of the same individual in the upright position. You can see in the first that the cerebral part of the brain is neatly contained within the skull, where it should be, and the angle of the odontoid bone is within normal limits. So it's when the person's upright that it is retroflexed and the brainstem is compressing. And this is the same thing that's happening to me. This is why when I'd have symptoms, I'd have to lie flat or lie. That's why I lie back with the pillow supporting me a lot when I'm talking on these videos, because I'm trying to take as much weight off of it. Because after a while, it's hard to be upright. But this, like I said in the video about this is really helping. So yeah, in the second image, however, there is a downward displacement of the cerebral tonsils. So the second image refers to the upright one. The connective tissues here are too weak to hold up the cerebellum, resulting in a tonsillar herniation. Additionally, the odontoid bone is retroflexed, putting pressure on the brainstem. This is a problem that is really insidious to see, and it's a really, really problematic thing. It's an awful thing, as you can hear. So here's the image that I just read about there. The person is lying down on this side and upright on that side. So here, now I can have it all on paper and I don't have to try and explain it. A heavy headache, a constant or near constant headache that can be described as feeling like the head is too heavy for the neck to support, feeling like a bobblehead. Oh man, that's a perpetual thing. That sounds so familiar to me. Sounds so familiar. That's exactly it. Either it's always there, and but it's worse. Like the more that you're upright, it can get into a pressure state, and it's like, and it actually, like, it doesn't make a sound like that, but it sort of feels like that. And it's just like, it feels like a boot is like pushing up against your back of your skull, and you start to get dizzy and like dry mouth and like really bad pain, and it's like you want to, in my case, I always feel like I want to pop my ears or yawn. A pressure headache, an impairment of CSF flow, causes intracranial pressure, which would be aggravated by yawning, crying, laughing, coughing, sneezing, and straining. Now that's weird because I definitely get aggravated by straining and coughing and crying. Crying, it sucks because like sometimes I feel like I need to cry about this. Like I'm falling apart. I cry. I have tears, but it's hard to get the tears out because it gives me a headache. It hurts me to cry. And that's really frustrating. I've always had that problem where it hurts me to cry. I mean, I do cry, but I end up having to blow my nose like 10 million times. And but it's weird because it says yawning and sneezing aggravate it, and personally I found that yawning and sneezing, like yawning as wide as I can, getting like a big yawn, or like popping my ears, or sneezing, I found that helps me, not the other thing. So I don't know if I'm weird or anyway. Dysautonomia. Yeah, see, it causes dysautonomia right here. Look, dysautonomia. Brainstem compression can lead to a dysfunctional autonomic nervous system. Symptoms of this include tachycardia, rapid heart rate, heat intolerance, orthostatic intolerance, low blood pressure when standing, syncope, fainting, polydipsia, extreme thirst. I often have dry mouth. Delayed gastric emptying, I have that too, big time. I have all of this. Chronic fatigue, yeah. Other symptoms: neck pain, central or mixed sleep apnea. The sleep apnea thing is pretty scary. I have to admit, like, if I'm having a hard time, I'll turn onto my side because I don't feel safe. I don't get like horrible sleep apnea, but if I'm like feeling like my breathing's heavy and my head is really inflamed in my neck, that night I will turn onto my side. Facial pain or numbness, I totally get that. I get like pins and needles in my face, and I get a numb mouth. It's so weird. It feels like I just like went to the dentist and got frozen, and like it like my tongue, it feels like I just got some Oragel or some Novocaine or something. It's really unnerving and scary actually. And that can happen when I exert too much. Balance problems, yeah. I get like that moving floor, like you're on a ferry boat, and it's really choppy out, and it's like you're on a boat, and it's tilting. That's a really unnerving feeling. When I'm like that, I have to. Luckily, I used to dance, so I have a pretty like strong sense of balance. So I pull out my dancing tools and like center myself. And I haven't actually fallen lately. I seldom fall. And if I do fall, I usually have a good reflex of grabbing onto something near me before I hit the floor. But yeah. So muscle weakness, that is for sure. Definitely. And that doesn't help. That really is an insult on injury because our collagen is weak already. So the last thing that we need is to get neuromuscularly weak in the spinal column. That really screws us over. And that's a lot to do with how we end up falling apart, because we end up with this CCI problem and it causes us muscle weakness. And we used to rely on our muscles to get us around, to hold us together. So when we lose that's really, really detrimental. So yeah, dizziness and vertigo. Yeah, totally. Vertigo especially. Vertigo is like that sense of spinning that I talked about. I get that. Vision problems. I get like really like sometimes I'll get like blurry vision if I'm really inflamed and I go to lie down for a while. When I get up, everything's like fuzzy. And it's like I can't focus my eyes, and it takes me a few minutes. It's really weird. And then I get the floaters, like when I get like, I think that's normal when you get really tired though, and I get tired, so. And then reduced gag reflex and difficulty swallowing. I get that. I have a hard time swallowing like bulky items. That's why I another reason why I pulverize a lot. And the gag reflex, the lack of gag reflex really sucks because there's times where I feel like I want to throw up. I feel really sick, like my stomach's upset, and I can't. And there's nothing worse than feeling like this is kind of TMI, sorry. Like you want to throw up and you can't. And yeah. Ringing in the ears and hearing loss. Oh my god. I've had tinnitus, like ringing in the ears since I was 18. And so much so that I'm used to it. Like it can, if it gets really loud though, it can interfere with my pitch, which is really annoying because I'm a singer and songwriter. Instantly, my ears, like I forgot that it's there. Uh, so nausea and vomiting. I do get the nausea, but again, I have that gag reflex, so very seldom do I. Yeah. Impaired coordination. Yes, I have very weak fine motor, and that really sucks. Um, like I can't write anymore. I only type. My printing is hard to read. It's just like scribble. My coordination too. Actually, like because I did dance before for a bit, and like I kind of used to work out at the gym. Like my coordination's not too bad, but if I'm tired, I'm super clumsy. I have to focus. I have to concentrate on it. Downward nystagmus. So when I'm having these really bad attacks, I get that my eyes go back and forth, twitchy really quickly. So that's what that is. I wrote about that on my Facebook page. Paralysis. Well, paralysis is in severe stages, like when you're herniated several millimeters, you start getting paralysis and then loss of like bladder control and all this and bowel control even. It's awful. So how is craniocervical instability diagnosed? Upright MRI and rotational 3D CT scans are the standard imaging techniques used to determine if CCI is present in individuals with EDS. A definite diagnosis of CCI can be made by a technique known as invasive cervical traction, ICT. ICT is an inpatient procedure where the patient's head is pulled upward by a pulley system. Ooh. If, over the course of 48 hours, the patient's symptoms are cleared, CCI is confirmed. Wow. Because ICT is rarely available in typical hospitals, as an alternative, a doctor may simply pull the patient's head up off the spine in the doctor's office. Ooh, geez. If there is a reduction in pain and symptoms, it confirms the diagnosis. Eek. Patients may also have an extreme worsening of symptoms if their head is pushed downward. Oh, geez. Speaking of pushing upward and downward, do you know what's really disturbing and icky is that when I'm washing my hair in the shower, when I'm scrubbing the bottom, if I'm, because sometimes I'm impatient, and if I'm going like this too vigorously, my skull moves off my neck, like it's like it's like ooh, and then it's all inflamed there afterwards, and then I'm paying for it, and I'm getting like a numb face and all this. It's it just feels yuck. Like imagine washing your hair and feeling like your head is like slightly subluxing. It's just frick no. So what is the treatment for craniocervical instability? Craniocervical fusion, a procedure in which the skull is pulled upward, cervical traction, placed into the corrected position, and then the occipital bone of the skull is fused to the upper cervical vertebra to hold the corrected position. The procedure typically involves the use of rigid hardware, typically titanium instrumented fusion, but can also involve a fusion construct combination of bone and bone matrix, as sometimes bone morphogenic proteins. This is when they sometimes take a piece of people's hip bones and stuff. Patients usually undergo rigid cervical immobilization following this procedure, cervical brace, halo vest, or custom Minerva until the occipital and cervical bones completely fuse together. In patients who also have a Chiari malformation, the droopy and damaged cerebral tonsils may be shrunk with the electrocautery. This shrinkage ensures that there is no blockage of CSF flow out of the fourth ventricle. This is a great article. They really know their stuff. So yeah, the main thing here is that it's not just about Chiari. You can just have a CCI without a Chiari and still be suffering quite a bit. And that's what's going on with me. Quickly, I'm going to show my own results